Welcome, everyone. As you all know, I'm Sherry, the Vice President of our school's Parent-Teacher Association, or PTA. I know you all read about the PTA's parent education program about skin cancer. We tried to get interpreters for the presentation, but no one was available. Then I called the American Cancer Society, or ACS. I was pleasantly surprised to learn that ACS can present an ASL for us and invited them to come. I feel that it's important to learn about skin cancer, and I thought it would be perfect to have you all come here. The morning was so beautiful, I thought we should take advantage of the outdoors. Of course, we're going to stay under this tent so we don't get too much sun. But before we start the program, let's be sure we all know each other. Would you like to start by introducing yourself to everyone? Hello, my name is Danny. Nice to meet all of you. Hello, my name is Tan Wen. Nice to meet you. Hello, my name is Sharina Lee. Nice to meet you all. Hello, I'm Yoon Lee. It's nice to meet all of you. Now I'm going to hand the program over to our guest speaker, Marla. When we were emailing each other back and forth to arrange this program, Marla told me that, just like us, she realized that she knew very little and needed more information about skin cancer. So, she researched different websites and found the website for the American Cancer Society and the National Cancer Institute's Cancer Information Service. There was a wealth of information that she collected. Eventually, she became quite well informed about cancer and wanted to share her knowledge with other members of the deaf community. So, she started volunteering for the local office of the American Cancer Society. Today, it's my pleasure to introduce you to Marla. Marla, maybe you could start your presentation by explaining what it means when someone has cancer. Why is that so dangerous? Everyone I know is really scared of getting cancer. So am I. Do you mind explaining that for us? Thanks for your kind introduction, Sherry. That question is a great starting point. Cancer happens when one or more of your body's good cells start to behave in a bad way. Normally, old cells are replaced by new cells in a very orderly manner. However, sometimes cells don't die, but start to divide and make copies of themselves faster and in a very disorganized manner. When that happens, they are called pre-cancer cells. They are not cancer cells yet, but they are not normal, healthy cells either. Often, those cells will make new cells that are even more abnormal. Eventually, some of those cells could become cancer cells. It is generally best to remove pre-cancer cells because we don't know for sure what will happen, and that way they have no chance of ever becoming cancer cells. However, sometimes the cells are not discovered in the pre-cancer stage. Instead, they are found when they have actually become cancer cells. They have already become very dangerous and must be treated promptly because they will make more bad cells. Sometimes these bad cells might spread to other parts of the body where they will cause more harm. I had some changes in my skin, but my doctor told me not to worry about them. They were just part of the aging process. Is that true? That's very possible. There are many changes in the skin as we get older. You may notice a spot that may be rough, scaly bumps on your skin, especially in areas that have been in the sun a lot throughout your life. They can be red, brown, or the color of your skin. You may feel like you want to pick them off because they are so rough and may itch or hurt. These bumps are called actinic keratoses. They are very common in skin that has spent a lot of time in the sun. Babies don't have them, but older people often have many. You can think of them as pre-cancers. They are not skin cancer, but sometimes, if they are not treated or removed, they can turn into a skin cancer over many years. There are two things to remember about actinic keratosis. The first is that only your doctor can tell you for sure if a change in your skin is a pre-cancer or cancer. The second thing to remember is that because the body's cells are constantly changing, you need to be constantly watching abnormal skin for further changes. Because of this, doctors sometimes recommend treating them with a cold spray or a special cream. So what's the difference between skin cancer and other cancers, like breast cancer or prostate cancer, for example? We generally name the cancer by where the first abnormal cells start. So if they start in the breast tissue, we call them breast cancer. If they start in the prostate gland, we call them prostate cancer. In the case of today's topic, we're discussing skin cancer. The cancer cells start in the layers of cells that make up the skin that covers our body, so we call them skin cancer. So with skin cancer, the bad cells first start to grow in the skin. So what actually happens when someone gets skin cancer? Why is skin cancer so bad? Skin cancer creates several problems. First, it causes the skin to look abnormal, not attractive. When you have skin cancer, the cells appear on the surface of your body. Because they are not healthy cells, they can bleed or ooze and look like infectious, ugly sores. The second problem is that the skin provides a protective layer around your body. It keeps bad germs out, and it helps maintain the right balance of water inside our bodies. So when skin cancer develops, it causes a break in the body's defense system. The third problem is really dangerous. Sometimes the skin cancer cells move from your skin to other parts of your body. That can make your whole body very sick, and it can kill you. When the bad cancer cells move from the skin into other areas of your body, it is called metastasis. So what causes skin cancer to start behaving abnormally in the first place? Skin cancer is usually caused by having your cells exposed to too much sun. That's why most skin cancers are on the parts of your body that get a lot of sun, like your nose, the tops of your ears, and your arms. However, we also know that getting one very bad blistering sunburn can also increase your risk of getting skin cancer. So you often see skin cancer on the shoulders and back because we often get really badly sunburned there. A little later on in this presentation, I will explain the many things that you can do to prevent skin cancer in your children and yourselves. I wanted to learn as much as I could about this topic, so I did a little reading about skin cancer at the library and on the internet to get some basic information. Could you clarify something for me, please? It seems like there are different kinds of skin cancer. Is that right? Yes, that's exactly right. There are 3. The specific names of skin cancers are basal cell skin cancer, squamous cell skin cancer, and melanoma. Often you'll see the word carcinoma used, but that is just another word for cancer. All 3 kinds of skin cancer can be caused by too much sun. What is basal cell skin cancer and what part of the body does it affect? Basal cell skin cancer is the most common type of skin cancer. It usually does not spread to other parts of the body, or in other words, metastasize, but can grow very big and cause big sores on your skin that do not heal. It can happen on any part of the body, but is usually on the skin that is exposed the most time in the sun, such as the head, neck, arms, and legs. What does it look like? Basal cell skin cancers usually look like red, round bumps or sores, but they can be pink or clear too. With some people, they may bleed, itch, or hurt. But for other people, they don't feel any difference. Basal cell skin cancers can grow fast or slow, but they tend to grow slowly in size. They will not go away on their own. If a doctor does not remove the basal cell skin cancer from your skin, it will continue to grow and look even worse. People who don't seek treatment can lose their eyes, nose, and ears as the skin cancer cells take place of healthy normal cells. Therefore, if the skin cancer is allowed to continue growing, it will also be more difficult to treat. Basal cell skin cancer can even become metastatic if they are left untreated for a long time. Remember metastatic? That's the term doctors use when the cancer spreads to other parts of your body. So how is basal cell skin cancer different from the other 2 skin cancers? Let's talk about squamous cell skin cancer next. Squamous cell skin cancer is the second most common type of skin cancer. Just like basal cell skin cancer, the squamous cell skin cancer usually shows up on the areas of your skin that get a lot of sun. Squamous cell skin cancer can have different looks, but it will often look like a scaly red bump or sore. It usually grows faster than basal cell skin cancer. Does it bleed or hurt like basal cell skin cancer? Yes, basal cell skin cancer and squamous cell skin cancer can bleed, itch, or hurt. Or the skin can feel completely normal. Squamous cell skin cancer can spread throughout the body and become metastatic. This could make you very sick. Since squamous cell skin cancer can grow fast and spread within your body, it is very important that you see your doctor quickly if you think you have one. If you don't see your doctor and it continues to grow, then you might die. Which one is the most dangerous? That is a good question. It's the third type of skin cancer. The third kind is called a melanoma. It is the least common kind of skin cancer, but it is the kind that is most likely to kill you. A melanoma can appear on any area of your skin, even on areas that do not get a lot of sun, like the bottoms of your feet, inside your mouth, or even inside your eyes. Spending too much time in the sun does increase your chances of getting melanoma skin cancer, but your genes may also make you more likely to get a melanoma. Genes? What are genes? Can you explain that term, please? Genes are like instructions in your cells. When you are born, each cell has these coded instructions that make you who you are. They determine what color hair and eyes you will have, how tall you will be, and whether or not your chances of getting a melanoma are higher than other people's chances. You get your genes from your mom and dad. Each parent gives you a set. That's why you look a little bit like each of your parents. You have many of the same genes as your mom, dad, brothers, and sisters. Since you all have many of the same genes, if anyone in your family has melanoma, then you might have a higher chance of getting it too. Genes are not the only reason why people get melanomas. It is usually a combination of genes and sun exposure, and perhaps other factors that we don't even know about yet. What does a melanoma look like? That's a good question. A melanoma looks very different from the other two kinds of skin cancer. A melanoma usually starts from a regular mole that is a normal part of your skin. Moles are those little brown spots that most of us have on our bodies. So having a mole is not the same thing as having a melanoma type of skin cancer. However, having a lot of moles does increase your risk if some of the moles are starting to become abnormal looking. Because most melanomas start from a mole, they often look like a brown or red spot. But a melanoma can also be pink or tan colored, or it can be a combination of these colors at the same time. Some melanomas show up in a place where there was no previous mole. Melanoma is the most dangerous skin cancer of the three because all melanomas can eventually spread to other parts of the body. Even worse, there is not yet an especially good method to treat this type of cancer after it has spread to other parts of the body. So I guess the clear question is, how do we find a melanoma before it spreads? Here is where we have really good news. It's easy to see a melanoma, and there are very clear warning signs to tell you that a mole's cells are changing. So it's pretty easy to do if you know what to look for on your skin. So the first step is to find the moles all over your body. Make a drawing of your body and then mark on the drawing where each of your moles are located. Here's the simple list of 6 things to consider when you look at each mole. They're called the ABCs of finding a melanoma. The A stands for asymmetrical. The word symmetrical means that the two halves of something are the same. So asymmetrical means without symmetry, or without the two halves being the same. That means that when you look at the two halves of a mole, one half is not the same as the other. Moles or spots that are asymmetric should be an area of concern. The B stands for border of the mole. Normal moles have a smooth, even border. Melanomas have jagged or irregular borders. Some look like lace at the border. A border that is changing from a smooth border to an irregular one should be of concern. The C stands for color change. Usually moles are only one color. So if you have a spot that has more than one color in it or is darker than your other moles, you should see a doctor. The D stands for diameter. If you have any mole that is larger than the size of a pencil eraser head or greater than 5 millimeters, or if a mole of any size starts to grow wider, you should have your doctor look at it. The E stands for elevation change. The mole starts to grow above the normal skin around it. The F stands for feeling change. The mole just starts to feel different. It gets itchy, crusty, bleeds easily, or always looks injured. Since a melanoma skin cancer can happen in moles that you have had for a long time, it's a good idea to describe all the moles on your body, along with where each one is located on your body. Use your picture of the body outline to mark where each mole is located on your body and add a description of each mole. Write down on your diagram the shape, border, color, size, elevation, and feeling of each of your moles today. Keep that drawing so you can make comparisons of your moles at future dates. When you are doing this drawing, be sure to use a mirror so you can see all sides of your body. Of course, if anything worries you on the first inspection, you should call your doctor right away and get a professional opinion, because melanoma can spread and kill you if it is not treated early enough. Dermatologists are doctors who are specially trained to treat the skin, so they are the best people to tell you if you actually have abnormal cells that might be dangerous and should be evaluated further or removed entirely. Even if you aren't sure, but have a funny feeling about a spot on your skin, it is better to be safe and let a skin doctor check it for you. So can I actually check my own skin to see if I have cancer without having to go see a doctor? It is important for you to have your doctor check your skin, but you should also do a skin self-exam. If you have had melanoma before, it's crucial that you check yourself. You can have someone help you look for new red or brown bumps that don't look normal, especially for those parts of your body that are difficult to see. You want to look for any patch of skin that is changing colors or changing spots on your body. Don't forget to check all your skin, including your back, scalp, genital area, and your feet. The best time for a skin check is after a shower once a month to help you be aware of your skin. The most important thing to remember is to call your doctor if you are worried about a spot. I have a friend who's already had skin cancer and goes to the dermatologist every 5 or 6 months. Is that really necessary? That's about right. Once you've had one skin cancer, you are at increased risk to develop others because other parts of your skin receive the same amounts of sun damage. The doctor will check your wound and also check for new cancers. Also, remember, as we mentioned earlier, that if an immediate family member, such as your father or sister, has had melanoma, you have a higher chance of getting a melanoma too. In those families, everyone should have a full skin check at least once a year to make sure there are no worrisome moles on anyone's body. People who have multiple risk factors for getting skin cancer should also be checked more often. Skin cancer risk factors are things that increase your chances of getting skin cancer. Some of the risk factors are things that you can do something about, while others are things that you are born with, in your genes, remember? Your genes will influence if you are more likely to get skin cancer. In both situations, there are things you can do to protect yourself. Sun exposure is the most important risk factor for skin cancer. The more sun exposure that you get throughout your life, the higher your chance of getting skin cancer. A lot of our sun exposure happens when we are children, playing and having fun in the sun without proper protection from the sun's damaging rays. But even when you are an adult, sun damage continues to happen. Sunburns, especially blistering ones, increase your risk of skin cancer and are a warning to you that your skin has gotten damaged from too much sun exposure. The good news about sun exposure is that there are many things you can do to limit the amount of sun exposure and the type that you get throughout your life. We will talk about some of these ideas later. The bad news about your skin is that the damage you do every day is added to the skin damage you experienced earlier. Your skin never forgets the past damage. Even when your sunburn goes away, the cells have still received some degree of damage. So there is much to be gained if you can greatly reduce future damage. And remember to protect yourself now. Does the color of your skin, whether light, medium, or dark, play a role in how much at risk you are? Yes, in a way it does. People who have blonde or red hair, light skin, and blue or green eyes, very light-skinned people, are at a higher risk for skin cancer. People with red hair, very white skin, and many freckles are especially sensitive to the bad effects of the sun. However, even people with tan skin, dark hair, and dark eyes get skin cancer. It is important to remember that even though people with light hair, skin, and eyes have a slightly higher risk of skin cancer compared to people with darker hair, skin, and eyes, everyone is at risk. I know a lot of friends who go to a tanning salon. Is that a safer way to get a tan without getting sun exposure? Tanning salons are becoming very popular. Many people are unaware that going to tanning salons also increases your risk of skin cancer. Tanning salons use lights that are just like the sun. This means that going to a tanning salon without any protection can cause you to get skin cancer. Since people usually do not put on any sunscreen when they go to tanning salons, their skin does not have any protection. This can lead to skin cancer. If someone in my family has had cancer before, does that mean I have a higher chance of having it also? You should always ask your family members if they have had skin cancer. As we mentioned before, there are some skin cancers that happen more often in families. Melanoma is the best example of this. A person whose father, brother, sister, or mother has had melanoma has a higher chance of getting melanoma, even if they do not spend too much time in the sun. Therefore, it is very important to know if anyone in your family has ever had skin cancer so that you can tell your doctor. As I mentioned earlier, if anyone in your family has had melanoma, you should have your skin examined by a doctor at least once a year. My friend has many moles. Do you think she should go to see a doctor? Well, that depends. Any moles that are changing should be seen by a doctor. Remember the ABCs of finding a melanoma that we discussed earlier? Wow, it seems that for anyone it is easy to get skin cancer. How can I avoid getting skin cancer? There are numerous ways you can prevent yourself from getting skin cancer. The first way is to limit the time that you are in the sun. It's considered safe to be in the sun every day. Well, it isn't realistic to never go in the sun, especially since we get sun exposure even when we are driving in our cars. You should try to stay out of the sun from 10 a.m. to 2 p.m. when the sun is the strongest. So getting up early and playing outside or waiting until after 2 p.m. is best. You can go to indoor pools instead of outdoor swimming pools, or swim in the early morning or evening. It is also important that babies younger than 6 months old be kept out of the sun. Their skin is very delicate and they can get sunburned more easily. If you do have to bring babies outside, then it is very important to wear protective clothing. Will wearing a hat help protect my skin from cancer? Of course, a hat is a very good way to help protect your face, ears, and neck. The hats that are big and floppy and cover your neck and ears are best. In addition to a hat, you should wear other kinds of protective clothing when you are in the sun. Protective clothing such as hats, long-sleeve shirts, and long pants give you the most protection from the sun. Choose hats and clothing that have a tight weave to avoid letting the sun reach your skin. There are companies that make some protective clothing so that you can cover up your skin without being too hot or uncomfortable. You should also remember to wear UV-protected sunglasses when you are out in the sun, or even driving around. Just like your skin, the sun can damage your eyes too. My wife always makes me put on sunscreen every single day. Do I have to? Wearing sunscreen every day as part of your normal routine is the exact right thing to do. A sunscreen is a special cream that helps to block the sun from getting into your skin. It is one of the best ways of protecting your skin from sun damage when you have to be out in the sun. There are many different kinds of sunscreen that you will find at the store. There are many varieties. Some are waterproof. That means they will stay on while you are swimming or engaging in other water sports or work that requires you to use water. Some sunscreens are just water resistant. They are not as effective because they come off more easily when you are in the water. Both of these sunscreens will come off onto your towel when you are drying off, so it is important to reapply them after swimming. The sunscreens all have different numbers on them. What do these numbers mean and which one should I buy? The numbers tell you the sunscreen's sun protection factor. That's called its SPF number. So the higher the number, the longer you can stay in the sun without damaging your skin. Even when you are in the sun for only a short period of time, the higher number also means you will get more protection. You should choose a sunscreen that has an SPF of at least 30. But in general, the higher the number, the better. A sunbeam is made up of several different rays. Think of the different colors of the rainbow as a way of seeing how sunlight has different rays. The two rays are called ultraviolet A, UVA, and ultraviolet B, UVB. So you want to buy a sunscreen product that says it protects against both UVA and UVB. Both together protect better. Your skin must be protected from these two rays that cause skin damage. Also, you want to buy a sunscreen that also includes a chemical that physically blocks the skin from the sun. The best ones are called zinc oxide or titanium dioxide. There are now many good facial moisturizers that include these chemicals. So it is reasonable to encourage people to use them as part of their daily grooming routine. How and where should I apply sunscreen and how often should it be used? Good question. Simply buying a sunscreen lotion with all the 4 components is only part of the protection. The other part is applying the lotion correctly. You should put your sunscreen on all areas of your skin that are exposed to the sun. Do not forget your ears, the back of your neck, and the back of your hands. If you have a receding hairline, you will need to be especially careful to protect the top of your head. If you're applying sunscreen to a child, always be careful not to get sunscreen in the child's eyes. You should apply your sunscreen 30 minutes before going outside in the sun to allow time for the sunscreen to bond with your skin. You should reapply the sunscreen after you have been in the water and every 2 or 3 hours while you are in the sun. Why do you have that pile of sunscreen in that basket? Well, yesterday I saw a doctor and we were talking about my face, and he was lecturing me because he was worried about my skin and told me that I have to apply lotion on my head and face. I told him I have lotion, but he said that I need 30 or above. 30 what? 30 SPF or above. And I looked through what I had and realized that some were only 15, and I had to follow his recommendation. He said to make sure that they are not more than 1 year old, but mine seemed to be more than a year, so I have to throw them away. So that's why they're here. You can check. Anyway, I have these bottles and both are 30 SPF. I did talk with the doctor. I told him I didn't want to bother. You know, when I play tennis, I don't want my hands to get greasy from the lotion, and I didn't want to bother with that. And he said that there are different ways that I can apply it while I'm playing. He said first, I must cover everything, my head, behind my ears, under my eyes, and other skin under my shirt that is exposed. But while I'm playing tennis, I will sweat. So to avoid greasy palms, he said I could put it on the back of my hands and then put that on my head. And I can use pinkies under my eyes and behind my ears so I don't have to use my palms at all. Did the doctor give those to you? Yes, he gave me 2. One for me and one for you. Now we have to help remind each other about this every day, okay? Can you explain what happens after I tell the doctor that I'm worried about spots on my skin? How do they make a diagnosis? Although a dermatologist will usually know if something on your skin looks like a skin cancer or not, the only way to know for sure is with a skin biopsy. To do a skin biopsy, the doctor will take a very small piece of your skin and look at it under the microscope to see if there are cancer cells. There are doctors who just look at skin samples. They are called pathologists. That's the person who will look at your small piece of skin to determine if the cells are normal, abnormal, or cancer cells. If there are cancer cells in the piece of skin, the pathologist will be able to tell you and your doctor whether the cells are basal cells, squamous cells, melanoma, or another kind of skin cancer. Knowing the kind of cells will help the doctor to know what kinds of treatment will work best. Does a skin biopsy hurt? Is it major surgery? The skin biopsy procedure is very simple and only takes a few minutes. It's done in a doctor's office. There's just a little discomfort because the dermatologist will give you a little shot to numb your skin so you won't feel anything. It's a local anesthetic. The shot is only slightly uncomfortable, just a small prick, and you may feel the doctor working, but you won't feel any pain. Can you explain how a skin biopsy is done? There are a few ways doctors can take a sample of your skin. They can do a punch biopsy, shave biopsy, or excisional biopsy. Let me explain each one. A punch biopsy uses a tool that looks like a very small cookie cutter and quickly takes a small piece of skin. Usually, you will need 1 or 2 stitches. A shave biopsy is when you take a piece of your skin that is not as deep, so you won't need stitches for it. Sometimes your bump or mole may be bigger than the punch biopsy tool, and so the doctor will cut out the spot and put in a few more stitches. This is known as an excisional biopsy. You will always have a little scar from these procedures, but usually they are small and worth it to know for sure that your skin is okay. After a biopsy, you take care of the area like any other small skin sore. Keep it dry and covered. It is best to put an ointment like petroleum jelly or antibiotic ointment and change your bandage every day. If you have stitches, you need to go back to the doctor in 1 or 2 weeks to get the stitches removed. Your doctor will tell you when to return to have your stitches removed. What happens if I have skin cancer? What are the treatment options? There are a few ways to treat skin cancer. The treatment selected will depend on what type of skin cancer you have and how much it has grown. For fairly early basal cell skin cancer, a cream called Aldara is sometimes given. This cream works by stimulating your body to fight off the skin cancer by causing a localized inflammation. Your skin will be red and inflamed while you are using the cream. You use the cream for a few times a week over a course of a month or so, depending on how your doctor wants to plan your treatment. More often, the doctor will remove basal and squamous cancer cells by scraping them away or burning them. This has about a 90% cure rate. However, sometimes a few cells are missed and will continue to grow. Then the treatment must be repeated. If the cancer is serious, will there be options for surgery? You have other options for surgery to remove the skin cancer. First, there is surgical removal, where they will take a little extra skin from around the skin cancer. The pathologist will also look at the tissue and make sure there are no signs that any cancer cells are left in the body. Therefore, your scar will usually be a little bigger than the skin cancer because you have to take some normal skin to make sure all of the cancer cells are removed. When the skin cancer is on the face or ears, the surgeon's goal is to leave you with the smallest scar possible. That's called Mohs surgery. Have any of you heard about Mohs surgery? I read about Mohs surgery on the internet. It seems like that was a different kind of surgery, right? That's correct. Mohs surgery is another procedure that is used to treat skin cancer. It is named after the man who first used this technique. Mohs surgery takes as little normal skin as possible. While the patient is there, the skin is immediately studied under the microscope to see if there are any cancer cells visible. This process is repeated 2 or 3 times until the doctor reaches the point where the removed skin shows no sign of skin cancer cells. So as I said, this usually takes 2 or 3 attempts to be sure all the cancer cells have been removed. Then the surgeon stitches up the patient. Mohs has a 98% cure rate because you know right away that all the cancer is gone. It also leaves minimal scars. Can this surgery be done anywhere on the body? Actually, this technique is best used on the head and neck. But sometimes the doctor will check all over the body to help determine treatment. So if they decide to use Mohs surgery, the doctor's goal with Mohs is for the skin removal obvious. But more importantly, the doctor wants to be absolutely sure that there are no cancer cells still left in the skin that can continue to make new cells. So Mohs surgery is the best choice. When the skin cancer occurs in other parts, the doctor can just remove a slightly larger ring of skin from around the cancer cells to be sure all the cancer cells are gone. How long will the surgery take to heal? The skin will take 4 to 6 weeks to heal. There will usually be a small circular scar left where the skin cancer was removed. I have read in the newspaper that radiation can be used to treat cancer. Is that true? Will it help? Yes. Radiation is sometimes used as a treatment or together with surgery. The radiation kills any cancer cells that are left. Sometimes radiation is used for patients who can't have surgery because of other medical reasons. Radiation is also used for very large skin cancers or if the cancer cells have invaded other structures, like bone. This usually requires multiple treatments, but is painless. Is there a cure for skin cancer, or will there be a cure soon? While there is no cure for skin cancer, the treatments for basal and squamous cell skin cancers are quite likely to be successful. Of course, the best thing is to prevent skin cancer by reducing your time in the sun. If you do get skin cancer, the next most important thing is to find it early so it can be easily and effectively treated. What about melanoma? Melanoma is different. It must be surgically removed just as I described earlier. The skin will be numbed and the doctor will use a knife to remove the melanoma. The doctor will remove a larger amount of skin for a melanoma because this cancer is so dangerous. If the cancer is found early, before it has spread to other parts of the body, the only thing required will be for the patient to see the doctor for regular skin exams every 6 months or so. Your doctor may also want to check your lymph nodes. If this melanoma cancer has spread, it is much harder to treat. Medicine is given that will spread throughout the body with a hope of killing any melanoma cancer cells that have spread to other parts of the body. The medicine is called chemotherapy because it is a chemical that is used for the therapy. However, the chemotherapy treatment options for melanoma are not yet very effective. The good news is that a lot of research is being done to try to find better treatments for metastatic melanoma. When doctors are testing new methods to treat cancer, this is called clinical trials or research. Doctors will sometimes ask patients if they would like to join a clinical trial that is testing a promising new therapy. This can help doctors learn more about skin cancer and how to prevent it or treat it. Thousands of patients will be enrolled in these studies to determine if the new therapy is better than the therapy already available. You can learn more about participating in research by talking with your doctor or contacting the National Cancer Institute's Cancer Information Service. Or the American Cancer Society, ACS. There are also good websites that can help you find studies that are being done. Well, I hope you learned a lot from this program. Even more important, I hope you will take the steps I discussed for preventing skin cancer and finding it early. This could save your life or the life of someone you love. So please join me in helping to spread this information about skin cancer. The deaf community really needs to become well informed about skin cancer. It is both preventable and treatable if you have the right information. Together, we can reduce the effects of skin cancer on the deaf community. It's been really fun for me to have this opportunity to talk with you. I know the folks at the American Cancer Society and the National Cancer Institute's Cancer Information Service join me in thanking you for your interest in how to prevent and control cancer. This is one of the cancers where we know what to do to prevent this cancer and find it early. There are specific actions you can take and recommend that others follow that will make a huge difference in reducing unnecessary pain and suffering and premature death. Please remember that you can contact both of those organizations if you have any questions about skin cancer or any other cancer. I'll give you the specific information you will need to contact these organizations. Wow, thank you for coming and informing us about skin cancer. We are more educated now and will share this with others. Thank you. Thank you, Sherry, and thank you all.